talking about stress and how we can nourish our wellness at times of stress. Hi, I'm Dr. Bibi. I'm a doctor of clinical nutrition, and every week we meet here with awesome topics on functional wellness and functional nutrition. And we have prepared those topics specifically with the Global HR Summit team, and I hope you're enjoying them. So let's start talking about stress today. So today we will be talking about the stress and understanding and managing stress. Before we start, let's measure. What's your stress level from 0 to 10? You could be at 3, you could be at 5, or maybe at 10. Where are you? You cannot make modifications before you know where you are. So it's very important to measure your levels of anything before you start acting on that thing, right? And stress is also unavoidable most times, but it can be managed, and we can define this as how we interpret and internalize is up to us. And then we'll also talk about what happens in the body when we are stressed and all the functional nutrition approach and the holistic solutions. Stress response. Body's stress response is directing the focus to fight or flight. So it's an ancient response. And when you're stressed about something going on at work, you had a rough meeting, you had some arguments with a colleague, or issues at home with your kids, the body doesn't differentiate if it's a modern day stressor like those, or an ancient stressor like you're running away from a bear and you're trapped in a cave and you need to defend yourself from some predators, something going on there. So the body doesn't differentiate that. So it is the fight or flight response. In that response, what happens is your adrenal glands, they sit on top of your kidneys. They secrete hormones like cortisol and adrenaline, and those actually increases your energy levels so you can run, fight, or also cortisol increases blood sugar. When the blood sugar is increased, your brain uses that blood sugar to make better informed decisions, to act faster, to be smarter. It also helps for the tissue repair. If you have damaged tissues, it helps to repair the tissues. So these are all the fight or flight responses going on to the body. And the body cuts down seemingly unnecessary functions at that moment, like digestion. You don't need to digest anything. You don't need to sit down and enjoy a feast when you are running away from something or hiding from something, right? And we also have to differentiate between the short-term stress and the chronic stress. And short-term stress is you had a significant issue that creates a stress in your life. It could be a life event. It could be something that is happening at work, or it's a chronic stressor for you. That stress has been going on for weeks, for months, for years sometimes. And they have a significantly different impact on health versus the short-term stress. And we really need to focus on managing that kind of stress, chronic stress, better than the short-term stress, because the short-term, we can always mitigate the negative health effects after the stress is over. However, the chronic stress is ongoing. So your adrenal glands keep making cortisol and adrenaline, and they get tired, and your systems get tired and worn up. And then it leads to many health issues, such as cardiovascular disease, immune suppression, digestive health issues, mental health issues like anxiety, depression. It does have a significant effect on digestion and metabolism. It lowers the stomach acid. Remember that we talked in the previous videos that making the stomach acid is a very energy needing process. So when the stress is high, we have low energy for digestion. So the body cannot produce enough stomach acid. So the digestion of the proteins especially, but like all the foods, are impaired. Irritable bowel syndrome Sometimes we see diarrhea, sometimes we see constipation, sometimes like alternating episodes of that. Digestive upset, nausea is commonly seen with stress. Weight gain. When you're stressed, the body actually thinks that, oh my goodness, we have to make sure that we are storing all the foods, and especially at the mid level, so where the organs are, we need to make sure that we turn everything as much as possible to fat, and especially visceral fat, the middle level fat. And we need to make sure those organs are protected. What if we're trapped in the cave longer than we planned and we don't have enough food? So we need to make sure that we have extra fat. So if we need it in the later times, in the later days, we can burn it up and use it for energy. So since the body doesn't differentiate if we're trapped in the cave or you're stressed about something at work, the weight gain, the middle level, midsection, not middle level, midsection weight gain is very high in the stress. And there's the microbiome issues. We have all those like amazing bacteria that live with us, that help us, that help our gut and brain. And all those bacteria get disturbed when there's stress. And this disruption impacts a lot of things going on in the body. We know there is a gut-brain connection. We have the central nervous system up in the brain, enteric nervous system in our gut, and they have a solid connection, and they have a very delicate balance in them. The stress impacts motility, how fast things move or how slow things move. Sometimes it's like very fast moving things, the foods, we might have diarrhea and not absorption of those nutrients. Sometimes they get stuck, they don't move, and we have the constipation. And when there's constipation, the toxins get absorbed back into the body again. We don't want any of them. Sometimes there's the secretion issues, like pancreas may not be secreting our digestive enzymes properly when we are stressed. Or permeability. Sometimes when we're extra stressed, especially with the chronic stress, there's the leaky gut where the food molecules get actually inside the bloodstream without being properly absorbed in the intestine. So the gut becomes almost like permeable and lets the larger food molecules get into the bloodstream without the proper barrier there. And there's a bidirectional communication between the gut and the brain. So the gut impacts the brain and the brain impacts the gut, so vice versa. And if there's an issue in that connection, it leads to problems like IBS, depression, anxiety, and more. So what is the functional nutrition approach to stress? I cannot emphasize more on whole nutrient-dense foods. Basically, it is the solution for everything, but at times of stress, we need to balance the macronutrients for stable energy levels. Because if our energy is not stable, it's up and down the place, that triggers the stress even more and creates a loophole, and it becomes really hard to get out of that stress further. Support their digestion if it is needed, because when you balance the macronutrients, it means that you will be lowering the simple carbs, you will be increasing the more complex carbs, maybe like the beans and whole grains, or things filled with fiber. And then you will be increasing the protein, you will be increasing the fats. But remember that I mentioned the stomach acid levels will be going down with stress. So you do not have enough stomach acid levels to digest the foods, especially the protein. So what should we do in that case? You can support their digestion with the digestive bitters. You can take some digestive bitter herbal mixes before the meals. You can use apple cider vinegar. You can put in a little water. You can put some apple cider vinegar inside, 1 tablespoon to 2 tablespoons. That will help you to increase your stomach acid levels. Fermented foods, pickles, kombucha, kimchi, They all increase the stomach acid levels. Digestive bitters both increase the stomach acid levels, but at the same time, it triggers our body to produce more enzymes, more bile for digestion of fats. You can also take supplements for enzymes, stomach acid, or bile. But here, make sure that you work with a nutritionist, because if you have ulcers, you shouldn't be taking the stomach acid supplementation. You shouldn't be using the enzymes over a long term, like over 6 months to a year. That will be too long for the enzymes, because we don't want our bodies to stop making production of those enzymes. Bile supplementation is needed if you do not have a gallbladder, not all the time. Only if you eat high fat meals. And there's also the importance of micronutrients for stress resilience, like magnesium, B vitamins, vitamin C. There's all these different types of magnesium. Magnesium citrate is used if you have constipation to move things forward faster. Magnesium glycinate is great for absorption for muscles. The same thing for magnesium malate, or magnesium threonate that you can use for stress resilience, for the brain health. B vitamins, I always recommend a B complex. I don't like the isolated B vitamins, especially please do not take B12 by itself. It impacts B folate levels as B12 levels go up. Sometimes folate levels we see going down. So always consult with your doctor or nutritionist in your supplement levels, what you should be taking and what form you should be taking as well. There is also the topic of adaptogenic herbs and supplements. Adaptogens is a category of botanicals that helps us to manage our stress hormones, cortisol, and helps us to adapt to that situations. They could be very effectively used in the stress management, such as ashwagandha, rhodiola, holy basil, or tulsi. It's another name for holy basil. I like the tulsi tea. It has a rose-like taste that you can use daily, sometimes 1 to 2 tea bags per day. Ashwagandha and rhodiola. Ashwagandha is more for long-term use for the stress resilience. Rhodiola is for immediate stress response. If you have an immediate stressor and you want a relief within half an hour, rhodiola is a great herb. However, make sure to work with a nutritionist to find the correct dosing for you. If you can, if you have like certain medications, they need to be adapted. Some of those herbs do not work well with the medications. A good example of that is St. John's wort. I didn't note it down. I don't want to endorse it for anybody because it can cause a lot of issues if you're taking any depression or anxiety medication. It impacts the levels of serotonin in the body and can lead to potentially fatal serotonin syndrome. So be mindful of St. John's wort. It's usually recommended for mild to moderate depression, but if you're using any medications, it is usually contraindicated. It also can interact with other medications, so all the herbs should be checked with your medications, together with your medications, by your doctor or by your functional nutritionist. Whenever I prepare a plan, I make sure that there's a detailed information on the medications and in their interactions with all the herbs and supplements that I recommend. So make sure to keep those considerations in mind. Blood sugar regulation. Stress impacts blood sugar levels, and blood sugar impacts stress levels further, leading to mood swings, fatigue, cravings. If we can manage the blood sugar, we can really mitigate some of that stress response, and we can really find our way even we're experiencing high stress. If you can manage your blood sugar levels, it really helps you to balance your mood and energy by lowering the simple carbs, lowering sugar, bread, pasta, regular like rice, potatoes, and then increasing the fiber levels, like increase like whole grains, increase beans, flaxseed, hemp seed, chia seeds. Increase your protein intake, increase your fat intake, and make sure that you're getting correct supplementation if needed for the stomach acid and enzymes. And there's other strategies for balancing blood sugar through diet as well. You can add in foods that are rich in chromium, magnesium, and alpha lipoic acid. Sometimes supplementation can be used only when you work with a nutritionist in the correct dosing for those nutrients as well. For the foods part, you can incorporate pumpkin seeds, flax seeds, eggs that are rich in those nutrients. And we have talked about mindful eating. Mindful eating can be effectively used for stress reduction. If you are new to this area, make sure to go back and watch our video on the mindful eating. We have given great tips on how to lower the stress, how to incorporate mindful eating into our lives. And there's a huge connection between the stress and unhealthy eating habits. When we're stressed, think of all the things that you want to eat. Do you want to grab an ice cream? Do you want to grab a bag of chips? Or do you want to order takeout foods that are higher in fats? We call them the comfort foods for a reason. Sugar is known to calm the brain. So that is how it was used originally. Now we are using way too much sugar than we should be using. But in the original purpose, it was used to calm you, and it even had medical usages back in the days, in the ancient times. So if you are grabbing that ice cream, you are probably trying to calm your brain. Maybe 1 spoon would be sufficient to do that. If you're mindful and see how that spoon impacts you, sometimes you don't even want to go to the second spoon, or you might even just grab a couple spoons and put that ice cream back. Mindful eating actually creates a connection between the food and how you feel, and gives your body the time to understand if you really want that food or if it's something else that you need. If you just need extra energy, if you don't need that calmness coming from the sugar, if you need that extra energy, maybe you should be incorporating more protein and fats in your meals. Maybe all you need is some almonds that goes with it, not that extra spoons of ice cream or the whole tub of ice cream. Or if you're going for a whole bag of chips and kind of munching those chips when you do something, if you stop and connect with that single first bite of chip, sometimes you feel that you just need something crunchy, or you just need something with added minerals. Maybe you need some extra salt or extra minerals. Maybe you just need to drink some coconut water, which is nature's mineral electrolyte drink. Or maybe you just need to make an electrolyte drink with a little bit of honey, lemon juice, and a pinch of Himalayan salt or sea salt for getting this extra minerals. And that could be all you need. Or you just need 4 or 5 chips to satisfy you, not the whole bag of chips. Mindfulness give you the guide and actually the control to your body on what it wants and what it doesn't want, and what it actually wants instead. So you can eat your meals in a calm setting with a little bit of music, without any distractions or electronics, with calmer people, with calmer discussions, maybe or calmer talks. If you really need to have a meeting with somebody who you know is stressful, try to make sure that you don't have that meeting during the lunchtime. Make sure that you're having that meeting maybe after lunch, maybe when you're feeling really good after a balanced meal, and have your lunch with people who are giving you joy and happiness. So the same thing with when you're eating with family, calming down, having nicer discussions, not bringing stressful topics to the table when you're having the dinner or when you're having your food. So these are a couple practical tips that you can incorporate right away. And we cannot talk about stress without mentioning sleep. And I like the word sleep hygiene because it's not important to just sleep. We need to focus on the quality of the sleep and the quantity of the sleep. And sleep hygiene definitely helps you to go to both the quality and the quantity. But before that, make sure to track, before we even get to the hygiene discussion, make sure to track your sleep. There's great tracking apps. I love to use the one that is called the Sleep Cycle. That's an amazing app. But there are like so many great ones. If there's one that you like, please go ahead and start using that app regularly. There's devices like, the watches, rings that you can wear and track your sleep. Make sure to track it because you cannot change something that you don't know the measurement of. You cannot change it before you know where its levels are. And sleep hygiene is so important because when you create a good sleeping environment, um, that impacts the quality of sleep significantly. A good sleeping environment includes maybe a little bit cooler environment. Make sure to air your room where you will be sleeping daily. Um, Again, like this is not related to the sleep hygiene, but make sure to get sunshine at least half an hour, but ideally an hour during the day, because that helps you to have better melatonin levels at night when you're sleeping. Sometimes you can use a melatonin supplement. Make sure to work with a nutritionist there to find the correct dosing and correct form for your body. We don't want people to use high levels of melatonin, as it may cause drowsiness the next day. Or you can have maybe red tart cherry juice unsweetened, or red tart cherries, like frozen cherries is a great snack along with some almonds for nighttime because they have naturally occurring melatonin. So I deviated a little from the sleep hygiene, but coming back to the sleep hygiene, the room that you're in is very important. So are the things that you do, such as your bedtime routine, getting ready for the bed, a calm environment, maybe dimming the lights, putting a good music, putting some essential oils that induce sleep, like lavender or copaiba to lower the stress levels, minimizing electronics exposure, ideally 3 hours before sleep, but at least 1 hour before sleep, maybe using blue light blocker glasses at nighttime. Other tips, breathing, meditation, yoga, even like couple 5 breaths, 5 or 6 breaths that you take before sleeping can calm your brain and mind. And these are all important things because without sleep, we cannot get the sleep resilience. And when we're sleeping, the body is fixing the things that needs to be fixed and getting you ready for the next day so you can manage your stress much better and much effectively the next day. Other lifestyle factors for stress management, exercise. I cannot emphasize enough the role of exercise in stress reduction. People usually exercise for weight management or sometimes for like getting in shape. I tell them like do it for stress reduction. Once you lower your stress, because the stress usually plays a huge role in the weight issues. Once you lower your stress, it becomes an easier thing to tackle. Whether it's the weight, whether it's getting in the shape, or tightening up. But make sure to exercise daily for stress reduction. Daily exercise could look something like 10 minutes of YouTube video where you walk with that video, or do Zumba or dance with that video, or just get on a trampoline and jump and get that lymph moving, get that muscles engaged. You can do again like different exercises, more active yoga sessions. I have patients that start with 10-minute walks and then take those walks to outside later on, make it 30 minutes, move on to working with a trainer, and become so much healthier in their body and mind in their mid 70s, or mid 60s, compared to their 30s and 40s. Exercise has so many benefits beyond stress reduction on overall health. So make sure to incorporate 10 minutes of conscious movement into your day. And relaxation techniques. Meditation is great. Yoga, even 10 minutes of meditation would be great. There are so many apps for that. Yoga, there are so many yoga videos. There's no excuse for not doing it if that is your thing. Breathing, you can do breathing techniques by yourself or work with a breath coach. EFT, that is short for emotional freedom technique, or simply tapping, is a great technique that I personally love. There's a great book called The Tapping Solution by Nick Ortner. It has an audiobook with the same name. It has a movie with the same name if you are into documentaries, and it also has an app with the same name, where there's so many great short 8-minute to 10-minute mini EFT meditations that you can do. And it is super impactful, where you measure your levels before and after. And take my word for it, try it. You won't be disappointed. And creating a supportive environment for stress management. Your team, your family, your friends, anybody else that can support you in your stress management, or anybody else that is also stressed, that you can team up and do things together. Maybe change nutrition together, do book club together, or watch documentaries together, or you can go out and do walking together. Or if that is the team, can you and your team have walking meetings together? So these are all the things that you can either if you're virtual, you can put your earphones on and you can walk while you're having a meeting. If you're in person, you can get the whole team out and maybe walk and have the meeting at the same time. So there are so many things that you can do for stress management when it comes to the lifestyle factors. So what are the action steps you can take right away for managing the stress? Firstly, measure and track your stress levels regularly. See where you are, where you started. Did you start with 10? Did you incorporate some of those techniques and maybe they came down to 7 during the day? Does it go up to 10 again? Or were you able to maintain it at a 7, 6, or 5? It's so great to measure and track it regularly to see where you are and how far you have come. And evaluate if you have acute versus chronic stress. Create your action plan accordingly. It will be significantly different if you have chronic stress or acute stress. Ensure an optimal nutrition that works for your needs and your lifestyle. We may recommend 2 to 3 meals a day, but you might have blood sugar imbalances and that may not work for you. You might need 5 or 6 meals a day, or you might have your gallbladder removed. So you might need certain fats distributed throughout the day so you can absorb them better. You might need different supplements other than the ones that you're maybe taking daily that helps with your nutrition plan. And what are the lifestyle factors you can modify? Can you add maybe an audiobook to your day? Can you add some meditation? Can you add EFT? Can you add 10 minutes of exercise? Find your support system, find your support group, not only for exercise, but to navigate through life. Life has its own daily stressors. Your support system makes you stronger, better in all different areas of your life. Your support system helps you at work, at life, at home. So that support system is so important because it gives you a feeling of community and belonging as well. And that is further helpful for stress also. Supplementation is for you there with adaptogenic herbs for digestive support, for the micronutrients, for the vitamins and minerals, but only do supplement after consulting with a professional to do it properly and for your personalized needs. So these are all the tips that you can do right away. Every week we prepare great content with the Global HR Summit team before the Global HR Summit in Istanbul on June 5th and 6th. And until the next topic, stay functionally well. Bye-bye.